Welcome to The Whole Pineapple. I'm Ruby Boris.
And I'm Ann Judge. The Whole Pineapple is a podcast about wellness focused around fertility. And on these weekly mini episodes, we bring you bite-sized ideas for you to snack on.
Like breathing exercises, book reviews. Maybe we'll review some scientific research, or we'll share some wellness and fertility stories from our listeners.
So if you're looking for a tip or a trick related to your fertility and well-being, then you've come to the right place.
Let's dig in.
Welcome back to the Whole Pineapple Snack Edition. Hopefully you listened to the full, where we were lucky enough to get to talk to one of Ruby's relatives, who also happens to be a very experienced pelvic floor therapist. And we are happy to welcome back Abby Dunning to talk with us more about at-home exercises and what we can do to improve our pelvic floor. I think as we set it up, that means we're going to fix everything in 15 minutes. So I am super excited. Welcome back to the program, and let's start our countdown clock.
Yeah, tell us what to do, Dr. Dunning.
Here we go.
Yeah, like let's say, okay, we've seen you for pelvic floor. I know there's probably going to be some variation to what you're telling people to do, specifically with what their pelvic floor weaknesses and strengths and stuff are, but some general things. I know it's probably more than just Kegels, right? Or do you say Kegels? I don't know. Which way do you say it?
I know. I think sometimes I say a little intermix of both, and then often I don't use the word at all, and I'll just say pelvic floor contraction.
Yeah. Because I think that's all people hear if they hear anything, right?
Yes.
If they're like pelvic floor, that means I'm supposed to like clench at stoplights, or I'm supposed to like,
yes.
No one knows anything else they're supposed to be doing. So
Yes. No, it's just do your Kegels. That will fix all of your pain, all of your incontinence, all of whatever. Yeah, there's no explanation on how to do them.
First of all, I don't even know. Where did Kegels come from? Like, is there like a Dr. Kegel that invented? Yeah,
exactly. There is a Dr. Kegel, and I believe it was
I wish I was Dr. Kegel, I have to say.
He did a study in either pregnant or postpartum women, and found out that if you contracted your pelvic floor, you could reduce incontinence, I think is what this, where it originally came from. And then so that is where the Kegel came from.
Oh, I'm sure it was, I'm
sure there were people that were working on this before too. Like, how come he got to be the one that's like credited with the idea that you could flex your pelvic floor? I'm sure there was like some midwife that had been doing it for years. And
it just stuck. And I don't think I've ever met someone who has not heard the word Kegel before, at least coming to see me. But
apparently there's a right and a maybe not so right way of doing them.
One, I almost rarely, there's a time and a place for them for sure, but
much like having a soda pop, it's something that is a time and a place. But
there's a time and a place.
Well, I thought you could do them anywhere, Abby.
But if we go back to our original conversation, the pelvic floor does not work in isolation. It works in that whole core system. And so just by doing a bunch of contractions of your pelvic floor all day is not really going to get you to better functional coordination, if that makes sense. Sometimes it's like odd times where we need that pelvic floor to contract and lift to support that bottom of the pelvis. I'll kind of work them in that way. But a lot of times it's learning that connection with your pelvic floor first, learning how to sense it move with your breath and work within that whole system comes first.
So how do you help people get a sense of that? Like, how do you, if all anyone ever knows is like, imagine that you were, urinating and you tensed up and stopped a stream, and that's what a Kegel is.
Yeah,
like, how do you,
everybody heard. Yeah,
how do you help people even feel any other parts of what we would think of as the pelvic floor?
I always usually start with the breathing, because you need a good diaphragm activation and mobility in order to influence the pelvic floor. So
talk us through it, because I'm sure Ruby and I both have nurse's bladder, right? Where you've like worked 12-hour shifts and you've like have issues. Right? So, how do we do
I'm actually just thinking, I'm like, have I gone to the bathroom today? I don't remember.
I know. We didn't even really touch on any of the bowel and bladder stuff, but I have people connect with their pelvic floor by starting with breathing. If I was just to give one person one thing, it would be figure out how to utilize your diaphragm with breathing. And so I will sometimes have people put one hand on their chest, one hand under their belly button, and just kind of feel where the breath goes. Can they breathe into their lower tummy and not as much through up here? That sometimes will be where I start. Once they can kind of get that kind of like oversimplifies it. Really, when you're breathing with our diaphragm, we want, think 360-degree expansion of that lower rib cage. And so I will have people put their hands on the sides of their rib cage.
Like you're doing a Superman pose. You've got your like hands right there.
Exactly. Yep. Hands, you can feel those ribs. We're imagining like if you had an umbrella and the bottom of the umbrella was opening up, that is what you should be imagining is happening at your rib cage with every inhale. I mean, you obviously want ribs to expand outwards or forward, ribs to expand out to the sides, and also expand backwards, like where your thumbs would be. So you're imagining 300.
You want to know what I'm imagining? I'm imagining the dinosaur from Jurassic Park. Remember the ones that like spit the poison on Nedry?
The ones with like the little like...
Yeah, the ones with the little fin all around them where you don't see it at first and then it fans all the way out just before they spit the poison at you. But yeah, just like...
This is such a visual field. We're all using our hands.
I know. It's like you can't. And so imagining that 360-degree expansion. And once, you can kind of get that down and be like, okay, what can you feel happening at your pelvic floor? Can we feel it lengthen and relax on the inhale? And you're not pressing down on your pelvic floor. You're not like forcing it to push down, but you're just like, I'll cue people like, imagine your air is like filling the space of your bottom of your pelvis and just see if you can feel that pelvic floor let go and then stay relaxed on the exhale, but you might feel it kind of go back to where it was. And I'll just kind of introduce that with the breathing.
And this just feels nice to do overall. Like I feel more relaxed.
Exactly.
We don't take enough deep breaths just in daily life. So
it's like the tide going in and out, it feels like. So it's like you're taking these deep breaths, but you can feel that pelvic floor going up and down kind of thing.
Yeah, kind of move with your breath. And that's huge for getting it to relax. And often people can do a contraction, not always, but often people can do a contraction, but they don't really let go all the way, and that is often people who are holding a little bit more tension in their pelvic floor, whether it be for postural stability or tension, guarding state, whatever, like often they have a hard time relaxing. So connecting with your breath and feeling that just length and excursion of your pelvic floor downwards is just, if not more important than the ability to feel it coming.
Because we're both visualizing our pelvic floors right now.
So we got the breathing.
We got the breathing, right? So that kind of gets, like you acknowledging that the core is a system, that the whole thing moves with your breath. Then you can kind of start adding in, well, okay, how do I volitionally contract some of these muscles also? Like the breathing is like volitionally contracting your diaphragm, which is then helping relax and move your pelvic floor. Then if, we feel like it's appropriate and needed, I'll sometimes you can add in a pelvic floor contraction. A lot of times people are contracting their pelvic floor at weird phases of their breath cycle. Like sometimes they're holding their breath or some, where it's really like, if you think of that breathing mechanics, like as you are exhaling, that pressure system is moving things up and in. And so that's often where we need that lifting engagement of the pelvic floor. So it's helpful to, like when you're learning how to use it, to think about it on the exhale. And yeah, to know if you're doing it, you shouldn't be able, if you're like looking at your body in a mirror, you shouldn't be able to see anything else move if you're contracting your pelvic floor. A lot of times, I'll see people demonstrate pelvic floor and their like whole body tensions or they're just like clenching their butt cheeks or, and they don't have that coordination to do it without all of those components.
And it's more than just like a clench, right? Like, so it's more like, is it like an elevator kind of thing? Like you're lifting?
Yes, it's like a lift, right? Like if you think like your pelvic floor, obviously there's tons of pelvic floor muscles that make up that layer of that bowl. And so some of them are like constricting around the openings of urethra, vagina, and rectum. But then there's also more of that, some of those deeper ones are a part of that lifting system. So you need both like a squeeze, but also more importantly, like a lift. And so I'll sometimes explain it like that. So those cues of like stopping the flow of urine or stopping the passive gas is helpful, but then also like, can you also like, if you're trying to pull something up and inside of your body, how would you do it?
What do you say when people have looked online and they sell the like vaginal trainers, like where people are like supposed to be like lifting and pulling it?
Oh yeah, with the biofeedback and stuff, that you can have an app for that.
I try and steer people away from them. There's some people that, yeah, they've just bought into whatever they saw and they're using them no matter what I say. But again, it's not how our pelvic floor is meant to function, right? So it's not functional to just squeeze and grip around something. Your pelvic floor needs to move. I'll sometimes explain it as a trampoline. So with every movement, with every breath, like our pelvic floor needs to expand and lift and be able to be mobile and dynamic so that when we do cough or sneeze or we do jump or move positions, it's able to react and do its job. Where if it's just clenching and holding tension, it's not able to react.
That's a great example. And we talked a little bit in the full one about the overall abdomen and the core and how those muscles. So what do you tell people that they should do to strengthen their core? Because I know the people are like, crunches don't do anything. Don't do crunches. So like, what should people do if they feel like, gosh, I need to work on my overall core?
There is a time and a place for crunches too, but the big thing is remembering that the core is that deepest abdominal layer. And that is the piece that people are most often missing, where they can do all the sit-ups or
obliques and V-ups and all the
exactly V-ups and all these like crazy stuff. Like they might be able to do them, but are they just dominating through six-pack and obliques, or can they engage their transverse, breathe through the movement, and have that whole core system functioning well as you do that?
How do you engage your transverse?
It's hard to do it just like verbally, but sometimes I'll have people put like a hand like above, one hand above their belly button and one hand below if we're going to do this sitting or standing. And so the role, if we think about our breath, like the role of that transverse abdominal muscle is to kind of like flatten and pull and compress like things towards our center, and then also like expand. So then on the exhale, things are usually like coming, compressing. So it's moving pressure up. And then on the inhale, it's kind of expanding to help move pressure down. So if you were trying to engage your transverse, that would be kind of that flattening compressive motion, but it also has a lifting component too. So I think your pelvic floor and your transverse are kind of like BFFs, and every time one contracts, the other one is going to do that too. And so you can kind of use similar cues to get the transverse and or pelvic floor to fire.
Can you feel it on yourself? Like, can you feel if you've actually like engaged that muscle?
Well, I'm thinking it's probably like good form, right? I'm trying to think about like when people try to coach you on the best way to do like a crunch or plank. I think, is it that like when they're telling you to like lift in and up, is that the transverse that they're engaging?
So if you do that, like one hand above the belly button, one hand below, and I will try and have people get it on an exhale, usually to start. But if you think as you're exhaling, you're trying to pull your muscles away from your hand. So you're like getting that flattening piece. And also like if you could like pull your belly button like up. So it almost has, because that whole core system, it lifts the bladder. It kind of lifts your pelvic organs. And so you will kind of see like a gentle skin glide upwards if you are getting that transverse abdominis well.
And watching Ruby and I poke ourselves while you talk is a good example of why seeing a PT is so great, because they could like actually guide you. It's very hard to just like describe. So yeah.
It is.
Yeah. You can put your hand on somebody and say like right here, I want you to engage that. I know like when I saw my physical therapist, she would put her hand in different places on my abdomen. She's like, okay, you are doing a good job here, but I want you to focus right here to get that engagement in this other part of your abdomen. So I'm now realizing how difficult it is to do verbally.
It is very challenging, but another way might be also helpful to like see what might be a wrong abdominal contraction. So if you were to hold your breath and push out and kind of like bear down almost, that's a lot of times what people do when I ask them to contract their abs, is they're bearing down and bracing outwards. And so if you have your hand there, you'll actually feel that pressure is pushing into your hand rather than pulling away. And if we think about what that's doing to our pelvic floor, that pressure is also moving down on our pelvic floor and putting more strain on our organs and that pelvic floor, if that makes sense.
And then you're also adding the crunch on top of that. That's going to increase your pressure then, right?
Exactly. So if you think about a crunch, obviously that's a rectus six-pack abdominal movement, that trunk flexion. So we need six-pack to turn on to do that motion, but we also need that transverse and your pelvic floor and your breath to be working to manage that pressure and keep it going up rather than down. So really, if you cannot do a crunch without maintaining that flattening motion and instead things pop out into your finger or your hand, I would argue that your core system is not coordinated enough to be doing that motion. What
I was going to say is it's so amazing how interconnected everything is. Like, I know a while ago, my husband did PT for like a, injury from soccer with his foot. And it was like, he had to do all this like core work because it was like, yeah, the reason that you're having everything pull in this foot is because on the other side, that muscle, you're not using it. And so you're compensating. You're like, oh my gosh, all of these things connect and influence each other.
Right.
If you're not stable enough to do like a more advanced, like you can't go from nothing to V-sit kind of thing, you might have to start with something like a head lift, right? Like that actually does engage your core, just lifting your head off the ground.
Exactly. And so sometimes, especially like postpartum or during pregnancy, like that's what we're working on, is because like their whole pressure system has changed and they need to remind those deep core muscles like how to manage that pressure when you increase it. Same thing goes with like coughing and sneezing. Like, it can be helpful to try and engage those muscles in. So that might be a time where I have someone do like a voluntary Kegel or pelvic floor contraction, is like bracing and prepping for that increase in pressure and reminding it that that is when it needs to function and contract and lift.
One step at a time. Like, yes, you might be starting with like a head lift, but it will progress. Like, be kind with yourself and give yourself time. I have to say our fertility patients are like the most patient people in the world because they've had to be. They're like, it's like waiting for a Phil Collins song for the beat to drop. It's like there's like, you're waiting all the time. And then it finally happens. And all of a sudden you're like, wow, my core is actually like, I can feel a difference now.
Yeah.
Any other at-home tips?
The breathing is one. I mean, often just like stretching and putting your body in a position that like somewhat relaxes or like stretches your pelvic floor can be helpful to like build that connections.
I've heard there's been a lot of things out there on social media about how important it is to do like pelvic kind of stretches and make sure that your hips and pelvic muscles are relaxed. Like the deep squat, like people are like, you have to do a deep squat for like however many minutes a day or something, or the pigeon pose or something like that. Does that make a difference?
Yes, deep squats are great. Happy baby is great.
I love happy baby.
Yeah, child's pose is great. It's just kind of opening up that pelvic outlet just a little bit.
Are there any good resources you send people, like people who have no idea what we're talking about as we use these names of yoga poses?
We'll put some of Abby's favorite resources on the website. We'll put some resources on the show notes because I think there's some good YouTube videos out there potentially.
Yeah, some good YouTube videos. There's a couple like Instagram pages I can reference of like maybe places to start.
Have that visualization component rather than doing this on audio.
I know.
But you've been doing a really good job of explaining like with the different like analogies and things. It's been, I can totally tell the visualization process of things. So
okay.
But sorry to go off track. Back to the deep squats. So while we're doing our deep squats,
So some people cannot do a deep squat while keeping their heels on the floor.
That is my husband. We make fun of him all the time. Like the moment he starts to squat, he just tips on over and he's convinced that something is just not connected right. He's always like, eventually, someday when I die, do an autopsy.
Yeah.
You're going to find I'm like missing a tendon or something. And that's why I can't do it. So yeah, explain, why can't he do a deep squat without lifting his heels up?
You can do them supported, sometimes doing them like with your back against a wall, or holding on to a chair or a coffee table. You don't need to get like butt all the way to the ground. It can be someplace in between, or sometimes I'll have people stack some pillows so they can actually be sitting on something. So it's a little bit more supported position and easier to relax in. But yeah, again, you're just working on breathing, right? We're trying to relax our abdominals, relax our pelvic floor, feel that rib cage moving and all of those things just from a general relaxation and functional thing. Because if your abdominals don't move and your pelvic floor don't move, that can really set us up for developing some compensation strategies for both just functional movements, for pain management strategies, bladder control, all those things. So really it comes down to we need a functional core system in order to do all of that. It all comes back to the core. And remember, the pelvic floor is part of your core.
So, Anne, can you tell, like, anytime I have any kind of injury, I'm like, Abby, what should I do? Like, how am I standing that makes my hips messed up or something like that?
Oh, that's one more good question for posture, because that's another thing you see advertised, the like strange thing you wear that's supposed to like hit you in the back to make you have good posture. So how do you like encourage people to be aware of their posture?
I will sometimes have people do just like check-ins where they set a reminder on their phone, or certain times of the day, they're just checking in with how their posture is and how their breathing is. Usually if you can breathe well, your posture will naturally kind of stack, but you're thinking like you want your rib cage bowl to be stacked on top of your pelvis bowl. So if you are really like arched and hanging on like the ligaments in your back, your rib bowl is kind of pointed outwards, abdominals are really lengthened, or sometimes, when you have that really slouched, rounded position in the back, that really closes down that abdominal space. And then it just, if we go back to pressure, it just changes where that pressure is going. We don't have that equal symmetrical pop can anymore. Your posture can change.
You're like that pop can they used to sell in like the Spencer's Gifts that would dance back and forth and like wiggle around. So we want a nice straight up and down can. I like it.
Any posture, whether it's like the best posture ever, if you're doing it all day long, that's not great either. Your best posture is a ever changing and moving posture because our body likes to move, our joints like to move. So
this is great though. Yeah. Instead of doing Kegels at stoplights, just like spend some time to deep breathe or do a little squat and work on that core. I think that sounds great.
Connect with your core, right?
I try to tilt the pelvis so I'm not doing like the booty sticking out position all the time.
Yeah.
Oh, well, these are some really good tips. And like I mentioned, we will put some of Abby's favorite visual resources on our show notes so you can check that out. And then, like Anne had mentioned, check with your fertility provider or your GYN or your urologist for potential resources if you think pelvic floor or PT might be helpful for you. And I think it's probably helpful for anybody.
We all are appreciating our core and our pelvic floor a lot more after these episodes. So thank you so much.
Of course.
Thanks for joining us for this week's episode of the Whole Pineapple Podcast. We hope it was helpful.
If you know someone who could benefit from hearing the podcast, we hope you'll share it with them.
And don't forget to subscribe, rate, and review the Whole Pineapple on your favorite podcast app. Every rating and review makes us easier to find.
This podcast is sponsored by Seattle Reproductive Medicine and is produced by Audiotocracy Podcast Production. We'll see you next time. Have a delicious week.